Are you tired from relentlessly working full-time as a doctor? Well, there is an alternative. You can work less than full-time. I've done this for about 60% of my career. And in this video, I'm going to talk to you about my personal experience of being less than full-time, the pros, the cons, and everything in between. Stick around. In the UK, there is a 48-hour working time directive, which we know as doctors doesn't apply to every week, but it's over the course of a rolling rota. So that could be over 8 weeks, 16 weeks, 20 weeks. And what this means is some weeks you might be working 60 hours or more, and some weeks you will have 0 hours of work, and we typically call this a 0-hour week. If you work less than full time, your 48-hour week average then comes down. So if you're at 80%, it will be about 36 odd hours. If you're 70%, it might be closer to sort of 32, less than that. And if you're 60%, you could be working as little as 28 hours a week. And so those are the common ways in which you'll find doctors working less than full time. In my career, I have always worked 80%, and I've always aimed to do about 35 to 36 hours a week of the full-time rota. When I first started working less than full-time, this whole thing was very confusing. And I luckily had the help of a less than full-time champ in my local area who sent me a rota, sent me the breakdown, and told me how to do it. And since then, I've been flying. So when I first started working full-time, you had to have reasons. You had to have reasons that the deanery or the school felt were sufficient for you to be doing these work hours. So it would be caring responsibilities or religious reasons or other sort of extenuating circumstances. But luckily, this has now been extended to all trainees. So trainees can now choose to work less than full-time for whatever reason. And again, they can choose to work 60%, 70%, or 80%. So my personal journey has been less than full-time. After the birth of my first daughter, I went back to work 80%, and I did that for a couple of years. And around the time of COVID, I went back to full-time. And I did that for about a year or so, went off and had another baby, and then went back again 80%. My biggest pro from working less than full-time is the control over your time, in a way. So one of my power words is autonomy, and that's something I've learned about myself as I've grown up, and it's definitely something I want in the next phase of my life. I want autonomy over my time. And for the last 10 years, I feel like I've had little to no autonomy, and being less than full-time has afforded me a little bit of autonomy over my time. And what I mean by this is you pick typically one day a week where you won't be working, and then you pick from your on-calls 80% of your on-calls. So it'd be 80% of your long days, 80% of your nights, 80% of your standard days. So that's the general gist. So say you got your rota for the year, you know the days that you're working, but you're like, you know what, this is Christmas, this is a long day, I'm not going to do that day, but I'm going to do another day elsewhere. So you really have the decision about how you do or work your hours, obviously in fairness, and then it's decided or it's agreed with the department, and then it's gone on, it's ratified, that's your rota. Aside from the autonomy, one of the other obvious benefits is that you have less time at work. And with that, you can do what you want. So for me, my one day off from work has typically been to look after the children, at least until they were 2 years old, take them to activities, spend the day with them, spend time catching up on the household, batch cooking, things like that. However, what I'm seeing increasingly amongst my colleagues is, especially those who are going less than full-time for non-caring reasons, is that they're then using this day off to do extra training or do something that actually interests them in a way that they may not have gotten it within the training program. And this, I think, is really beneficial for them, but it's also beneficial, I guess, for the specialty in the long run, because it means that you're getting more skilled doctors at the end of it whilst they're doing less service with it. The downside to being less than full-time is less money. You will take home roughly 80% of what your colleagues are taking home. There is a little surplus that you get for being less than full-time, but that works out to be about £60 a month, and I reckon it disappears in tax anyway. But that was just to balance the books from the last pay dispute back in 2016. How this plays out with less money is I will sometimes be on shift with doctors who are more junior than me, and they are making more money than me. I am making more of the decisions than them, but it's just the way the cookie crumbles. You have less time at work than they do, they make more money than you. The other obvious downside is when you're working less than full-time is that they count every day off and they add it towards your training. So if you're 80%, which I've been, a year of training becomes 15 months. And if you're 70%, you can do the math. If you're 60%, you can do the math. So for every year I work, even if I'm gaining all my competencies as I have been, I will have to do an extra 3 months for fun. because I work 1 day less. Now, since 2021, where the GMC have said that training should all be competency-based and not time-based, there is an argument that if you're getting all your competencies within the 12 months, that you shouldn't then be forced to do the extra month. However, this is slowly catching on and it's not common practice yet. With the longer training time, you also have to get to grips with the fact that your juniors will overtake you. I started training in 2016, and had I not taken maternity leave, had I not been working less than full time, my CCT date would have been October 2023. So other people that I started with at that point are already consultants if they've taken no time out. People who started in 2017 or 2018 are likely to be ahead of me or closer to finishing than I am. Or a very classic case is I'm now working alongside a colleague of mine who is ST1 when I was ST3, and now she's ST5 and I'm ST6. So again, she's catching up. And if I carry on working less than full time, she may well overtake me if she takes no time out. So that's just something that you have to get to grips with and you can't let bother you. And if it does, then maybe don't work less than full time. The one thing I would say as well that I've noticed in my career, in my personal career journey as well, is that if you're repeatedly at work 1 day less, you will have less clinical experience and less clinical exposure. And depending on the type of learner you are and the type of doctor you are, this could potentially hinder your abilities to do well, right? In the sense that I work in a surgical specialty, and if I keep missing theatre days, then my clinical skills and my surgical skills will not be up to scratch. Luckily, I also work in a very varied specialty that you can choose to go down the gynae operating route, you could choose to go down the high risk obstetrics route, you could choose any route, and depending on the route you choose, this will have more weight or not. But also in terms of seeing things, if you're just there less than everybody else, you will see less unless you make up that time over the time. Do you know what I mean? Like if you're then training for 10 years, then yes, you're increasing your chances of seeing it. But if you're, at the certain stage you're at, you're going to have seen less because you have been at work less. And again, that's just something that you have to take responsibility for, and you have to find ways in order to increase your learning. So quickly going back to the pay discussion, where you get paid less, I've always felt that if you do an extra shift, like a locum shift, once a month or so, you can make that money up. And you could also find other ways to make that money up, right? You could do other types of jobs. But for the purpose of clinical skills, if you're then working clinically as a locum doctor once or twice a month, you can then, in essence, get those clinical skills back or make yourself slightly less disadvantaged than if you were there for not at hospital at all. So there are other ways to work around it in terms of the money and in terms of clinical skills. And like I said earlier, if you're someone who's taken a day off so that you can go and learn how to scan, then that's fine. In this last year, I feel like I've used a lot of my days off to pick up a skill known as colposcopy, and I have found that to be quite useful. So again, it's just working around the system to make sure that your clinical needs don't suffer, as well as your financial needs, but also appreciating that if you're delayed, like if you're working less than full time, that your time of completing training will just be further and further away. And as I'm now getting towards the end of training, that is now a bugbear for me, but I really don't regret any of the days off that I've had with the kids, off that I've had at home. I would 100% recommend working less than full time at some point in your career. I think it'd be really hard to work less than full time all the time, because again, like I said, you're just prolonging your training, and there may be very little benefit for that. There is an argument as to, do you work 60%, 70%, 80%? I think that's a personal choice. For me, I've never worked less than 80%, because sometimes even with the 80%, I feel like I'm not at work enough. And I don't know how working 60% will feel, because again, you have to think you're working 1 day less a week, you're probably working one set of on-calls less as well over a rolling rota, but then you have your annual leave, which can be quite generous. So then you might find that you're like not at work for weeks and weeks and weeks. So in my head, I'm like, if you're 60%, that would just feel way less. But I do think it's a personal choice, and that's my personal decision to have never worked less than 80%. I hope this video has been slightly useful. It has been a whistle-stop tour through being less than full-time. If it's something that you've enjoyed and you would like to know more, please leave a question down below and I will answer it in my next video. If you would like to ask me anything else about training in the UK, specifically within obstetrics and gynaecology, leave that as a question down below and I will get to it and answer it, maybe in video format or in the comments. For now, thank you for watching the video to the end. Thank you for engaging with the video. Please subscribe to my channel. I am trying to grow my channel. The stuff that I'll talk about on this channel will relate to my training in obstetrics and gynaecology and clinical medicine, as well as juggling that with and raising 2 kids and going on to try and build side hustles. So I hope that you stick around and I'll catch you in my next video. Bye.